Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Over the last 24 hours, we have identified 1,265 new cases of COVID-19 in Alberta, and about 15,600 tests were completed yesterday. This means that our provincial positivity rate currently sits at about 8.1%, and we have 13,719 active cases. There are 355 people in hospital. Of those, 71 are in the ICU. Sadly, we have now reached 500 deaths from COVID-19 in this province. This is a tragic milestone. My sympathies go out to the loved ones and friends of these individuals who are mourning the lives lost during what is a very difficult time to grieve. Though we have put new restrictions in place, I hope that everyone still seeks support, comfort, and help in ways that are also safe from COVID transmission risk. The daily rise in COVID-19 cases, as well as the growing number and extent of outbreaks in acute care facilities across the province, continues to be concerning. Healthcare teams are working tirelessly to ensure patients and staff remain safe, but we must do all we can to protect the patients in all of our care, which is why Alberta Health Services has been taking and continues to take steps to increase capacity in the system. In the coming weeks, they plan to make available more than 2,000 acute care beds and up to 400 ICU beds to be allocated for patients with COVID-19 across the province if they are needed. In some cases, these will be new beds. In other cases, these beds are existing hospital spaces that will be made available as patients are moved into continuing care beds in the community. To make this space available, AHS will be taking a variety of steps. This includes transferring patients out of acute care to continuing care wherever possible and safe, moving patients to available beds that are open in other parts of the province, repurposing other clinical areas to provide ICU care, and if needed, reducing additional non-urgent surgeries. These steps are being taken to make sure that there is sufficient capacity to meet the growing healthcare need. In order to allocate these acute and ICU beds, AHS will also be working with Alberta Health, continuing care operators, and other partners to open additional continuing care beds in the community. AHS will provide more specific information on changes as they are implemented in the days ahead. Effective today, AHS is also changing visitor access to acute care sites that are on outbreak or in communities that are under enhanced status. For patients admitted to hospital and in ambulatory care, including emergency departments, only one designated family or support person is permitted under specific circumstances. For maternity and postpartum units, one designated family or support person will be permitted. A doula or surrogate may also be permitted. For pediatrics and NICU, as well as critical care, up to 2 designated family or support persons are permitted. In end-of-life situations, 1 designated family or support person is permitted, and the presence of any other visitors must be pre-arranged with the site or unit. The extent of restrictions may vary site to site due to patient circumstances, operational considerations, and the ability to maintain physical distancing. To be clear, these changes are for sites that are on outbreak or in a community where COVID-19 transmission is high. Details about visitor policies in individual sites can be found on the AHS website. We recognize that these restrictions are very difficult for patients, families, loved ones, staff, and physicians. But these temporary measures are being implemented to help reduce exposure and spread of the virus in AHS facilities. My health colleagues will continue work with patients, families, and healthcare teams to support visitation appropriate to the ongoing pandemic situation in our province. Turning to schools, There are currently active alerts or outbreaks in 348 schools, about 15% of schools in Alberta. Currently, these schools have a combined total of 1,207 active cases. This number includes 179 schools with outbreaks, including 71 currently on the watch list. My thanks go out to all the many people who are working so hard to keep students, teachers, staff, and families safe. Thank you to parents and guardians who are teaching good pandemic hygiene at home and reinforcing the importance of compliance with measures at school. I know that there has been a burden on parents this year to keep kids home even with mild illness and to arrange for kids to stay home if an exposure has taken place in their class. Thank you to students who have adapted to new routines and habits to prevent transmission and to keep their school and their community safe. Thank you to teachers and school staff who are on the front line of preventing the spread among students. We appreciate everything that you do. I would especially like to recognize those in the grade 7 to 12 system who will be showing flexibility and resiliency in the coming days, preparing to move to at-home learning as was announced yesterday. Yesterday, as you know, the government announced a number of restrictions that will impact not only students, but the majority of Albertans in one way or another. I know these are complex orders with many perspectives. People have asked about my role in them. Under the Public Health Act, as Chief Medical Officer of Health, I advise the government on its public health recommendations. For many decisions, I present a range of policy options to government officials, outlining what I believe is the recommended approach and the strengths and weaknesses of any alternatives. The final decisions are made by Cabinet. As I have said in the past, I have always felt respected and listened to, and that my recommendations have been respectfully considered by policymakers while making their decisions. I know that the new measures will be difficult for many, but our healthcare system is at a tipping point, and we cannot allow it to go over the edge. We need Albertans to do their part. We need Albertans to follow every measure, and I mean every measure. Just as we all need to work together to be successful, the restrictions in place are only successful if they all work together. Please do not ignore the measures that may seem inconvenient for you. Picking and choosing which measures we want to follow or find easiest will not help us slow the spread of COVID-19 cases. I know that after months of public health measures, we continue to crave more social contact. This makes gathering restrictions even more challenging for many. I also understand many have concerns about being asked to not have other people in their home. But now more than ever, only those who live with you should be in your home. Overnight, we have received many questions about what is or isn't allowed. I want to alleviate some concerns. This restriction is in place to restrict gatherings of a social nature where mixing and mingling occur. This does not apply to service-based visits, such as visits from caregivers, health or childcare providers, and childcare providers can include family members, or babysitters. It also does not apply to co-parenting arrangements or shared households. Raising your family is not a social gathering. If your children live part-time with one family member and part-time with another, this can continue. If you live part-time in one household and part-time in another household, this can also continue. But as I said yesterday, I urge Albertans not to look for ways to get around the rules. Do not take advantage of exceptions that are in place for those that need them in order to avoid measures you simply don't want to follow. This risks everyone's health. We cannot bend the curve if everyone does not do their part. Outdoor gatherings of a maximum of 10 may also still occur. But to be clear, if you host a gathering in your backyard, guests cannot be coming into your house to use the washroom, get snacks, or to warm up. If they are coming inside your home, for any reason, that is an indoor gathering. We recognize many Albertans live alone, and we do not want these people to feel socially isolated at a challenging time. That is why they are permitted to have 2 non-household close contacts to socialize with. They must be the same 2 people for the duration of these restrictions. I have already heard from Albertans seeking exemptions to these rules. While a few exemptions may be considered in cases where there is aggressive testing and other extensive measures in place, and let me be clear, I'm now speaking about the sports restrictions, where there are requests for exemptions to the sports restrictions. We are considering exemptions in cases where there is aggressive testing and other measures in place, but the measures announced yesterday will only work if they are applied as broadly as possible. As I said, I know that these measures will be difficult for many, and I know that there is a lot of debate around whether they go too far or not far enough. The best thing that any of us can do is to be as vigilant as possible in our own lives. Regardless of where you live, please do everything possible to limit your contacts with those outside your household. The challenge of COVID is that none of us can bear all of these burdens alone, and yet the usual ways that we have used all our lives to support each other, like gatherings, giving hugs, or going out for coffee with a group of friends, are exactly the kinds of activities that can spread COVID quickly. We all need support, and we can support each other in different ways for now. Telephone calls, letters, texts, and outdoor visits are all great options. We all need to bring back the family Zoom calls and the virtual dates that were part of our lives in the spring. The more we do that, and the more that each of us goes the extra mile, the more effective we will be in reducing the spread during the next few weeks. We are in this together, and we will get through this together. Thank you, and I'm happy to answer any questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First question is Michelle Belfontaine with CBC. Go ahead, Michelle.
Hi there, Dr. Hinshaw. There's a question today at the Legislative Assembly about your recommendations. Did Cabinet adopt everything that you recommended when they came up with the restrictions that were announced yesterday? And if not, what did they reject?
As you know, it's my role to make recommendations and provide options with the advantages and disadvantages. It is also my role to be focused on the public health and preventive medicine expertise that I bring. And then it is the role of Cabinet to make the extremely difficult decisions about how to take that information and include, along with it, all of the other considerations that must be brought to bear on these very impactful decisions. And then it is their role to make those final decisions. And as I said, I am grateful that my recommendations have always been respectfully considered in the final decisions.
Operator, could you put through the next caller, please?
Yes, next caller is Jeff Slack with 660 News. Go ahead, Jeff.
Hi, Dr. Hinshaw. The Premier described yesterday's measures as the minimum restrictions needed right now. Is there a concern that this doesn't send a strong enough message to people to take this virus seriously?
The restrictions yesterday include, for example, no social gatherings of any kind indoors, and explicit prohibitions on those kinds of social gatherings in people's homes. We know from the research and the multi-jurisdictional analysis that's been done is one of the most effective measures that addresses the majority of where we have been seeing transmission occur are measures that reduce social gatherings. It's also very clear that we need to have multiple layers of measures all together, and that those multiple layers are more effective than just a single intervention. So these measures that were introduced yesterday, some of which came into effect yesterday, some of which on Friday, will impact transmission. And the most important thing that all of us can do is to follow all of those restrictions, because the more that all of us do that and the more those layers are implemented, the more we'll be able to bend the curve.
Operator, could you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Just to jump off Michelle's question, and this is a fairly simple question, I just need a yes or no. Did you recommend stricter measures to Cabinet?
The measures I recommended were a broad range of options. And again, there were different components to those. And the recommendations that I made, again, were respectfully considered within those final decisions that were taken.
Operator, could you put through the next question, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. I've got a question about the 3-week timeline for these restrictions in terms of evaluating if they're working or whether we need something stronger. Why 3 weeks, and will you also be looking at the data sooner? Previously, you've said that we might start to see the impact of some new measures after about a week to determine whether we need to change these restrictions or even tighten them up sooner than 3 weeks.
We know that the full impacts of measures typically are seen at about that 3-week timeline. And we also know from, again, some of those multi-jurisdictional studies that I mentioned earlier, some of those indicate that about 60% of the impact of measures can be seen within the first week or so. So we will, of course, be watching very closely the data. We'll be watching our cases. We'll be watching the patterns that we are able to monitor. And so, again, the 3-week timeline is the timeline at which point we will see the full impacts of the measures, but we can start seeing trends earlier than that, and we will be monitoring continuously. We won't be waiting for that 3-week mark before we do any monitoring.
Operator, could you put through our next caller, please?
Next is Kieran Levitt with the Toronto Star. Go ahead, Kieran.
Hi, Dr. Hinshaw. I'm wondering if I can get your thoughts on how the 300,000 rapid tests Alberta has received will be deployed in light of the public health emergency. And also, this is sort of a two-parter, your thoughts on the effectiveness of rapid tests in general, so how Alberta will use them and then how effective you think they are. Thanks.
As the Premier mentioned yesterday, we have received many rapid tests from the federal government. We've completed the validation of the first set, and those have been deployed into healthcare settings because that first set of tests does require a healthcare setting for the equipment, even though they are rapid. And so that deployment is taking place to be able to support rural and remote areas. The second set of tests, which are the rapid antigen tests that don't require a healthcare equipment, still require a healthcare professional to take the sample and run the test. And that second batch is under validation. The additional details about how those will be implemented will be available later this week. And I anticipate that, again, they will be used as an additional layer, not as a standalone option. We know that in some places where rapid antigen testing has been used to replace public health measures, it has led to significant outbreaks. And so rapid testing, because it does have some challenges with lower sensitivity, and I will emphasize that the tests that we have received are licensed for use in those who are symptomatic, not for use in those who have no symptoms. So those will be used, again, to be able to provide rapid results as quickly as possible when someone is feeling ill, so that we will be able to prevent further transmission from that individual. And again, that's the value that they add, is when they are added to other public health measures, they do not replace those other public health measures.
Operator, could you put through the next caller, please?
Next is Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hi, Dr. Hinshaw. You said that there may be 400 ICU beds that will be made available to COVID-19 patients by AHS. That's if they are needed. I was hoping you could clarify how many ICU beds are currently set aside for COVID-19, and then as well, you've spoken in the past about the need to balance the social life of individuals in facilities such as long-term care centers. Today you announced new stricter measures. I was just hoping if you could explain sort of why these changes were made today, and if you believe that this strikes a good balance.
So just to be clear, the restrictions announced today were for acute care, not continuing care. In continuing care, we have not changed the visitor framework, and that's related to the fact that as we've been doing our ongoing assessment with respect to the risk that visitors pose, we have not seen that visitors have been a major source of introduction of the virus. We do continue to monitor that, and I did send out a letter to operators of continuing care across the province several weeks ago when our case numbers were starting to rise, because a part of our continuing care visitor framework is to ensure that each operator of each facility has a visitor policy that takes into account the wishes and context of their residents and their families. And so what I asked is that the operators in areas with very high transmission rates, such as Edmonton and Calgary, revisit their policies and make sure that they were getting input from their residents and consider at that point making it somewhat more restrictive to just designated essential support people at that time. But the restrictions that I'm announcing today are specific to acute care. They are not for long-term care. And I'm sorry, there was a first question.
I'm sorry, Dylan, could you reiterate your first question, please?
Yeah, so just a clarification on the number of ICU beds that are currently available in those acute care settings.
Right. Sorry about that. So number of ICU beds, I don't know. I would have to ask AHS for the number they have set aside right now. As I've said before, the way that additional ICU or hospital capacity is made available is by stopping other procedures, so that unfortunately the way that that space is made available in some part is by winding down care for other people who can perhaps wait a little longer for it. So the 71 ICU beds that are occupied right now, there are other spaces available, but we'd have to ask AHS for that specific number.
Dylan, I can follow up with you after this event. Operator, could you put through the next caller, please?
Next is Dean Bennett with the Canadian Press. Go ahead, Dean.
Thanks. Dr. Hinshaw, I want to follow up just on what Dylan was talking about, because my understanding is we've had 70 ICU beds set aside, and today we've got 71 patients. So am I overstating it? I mean, is this, since this whole thing began, isn't this the first medical guardrail Alberta has blown past? Can you just contextualize it a bit for me? And if we start adding more ICU beds, this might be more of a question for AHS, but if we start moving patients around and having to monitor, do they have the staff for that? Are we going to be scrambling to find staff to monitor these ICU beds?
So the 70 metric is one that was set in the spring as the metric that would tell us when we hit 50% of that, that we needed to make changes because we were moving into a territory where we would have to be stopping elective procedures. I'll just say for context that on an average influenza year, at the peak of influenza, we typically have about 30 patients in ICUs. And so that 35 number, that half of 70, is again about what we see in a typical influenza year, and also that metric that would tell us we're moving into a time where we start having to impact other care for other patients. And so when we hit that 50% metric, that was one of the pieces of information that prompted the additional measures that were put in place about a week and a half ago to restrict some of the locations where we were seeing the highest risk of large spreading events. And then, of course, as you mentioned, we've unfortunately seen that continue to rise, which led to the restrictions that were announced yesterday. And that 70 metric is not the total available beds. Again, it's a metric that helped us to understand at what point were we crossing into territory where we were going to have to be impacting other patients' care. And that's why, again, it has prompted those decisions that were taken over the past couple of weeks. With respect to staff, AHS is working very hard to ensure that the current staff that they have are available by supporting them, again, as has been from the beginning of the pandemic, with appropriate personal protective equipment, making sure that as some procedures are being slowed or stopped, so scheduled surgeries, for example, then staff are freed up to provide care in other areas. And so staffing is absolutely a consideration in making those additional beds available.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
This is Lauren Pullen with Global. Go ahead, Lauren.
I just have a follow-up question to that, Dr. Henshaw. The biggest concern that we have heard from healthcare workers over and over again is having enough staff to be able to do this. And you did announce some pretty big expansions, preparations for the COVID-19 patients in hospitals. How many healthcare workers will need to be redeployed to meet this? Are there realistically enough specially trained staff to deal with the surge we expect to come? And what do you have to say to those healthcare workers who are already burnt out and exhausted, worried that they don't have enough specialized staff to deal with this?
First of all, I would say thank you for the work that healthcare workers are doing. And I know that my frontline acute care colleagues who I've spoken to are feeling that pressure, and I absolutely sympathize. And again, the numbers that I mentioned earlier in terms of planning, that's contingency planning. I would hope that we never have to utilize that volume of beds for COVID-19 patients, because that would result in the stopping of not just the elective surgeries, but we might even have to move to even more urgent surgeries being postponed in order to get to that level of beds. So I want to make sure that the healthcare workers who are currently working incredibly hard and to whom I am deeply grateful know that the measures that are being put in place, that were put in place yesterday, and any additional recommendations we make based on watching our trends will be made to minimize the chance that we will ever need to use those maximum numbers of beds.
Operator, could you put through the next caller, please?
Next is Charles Rusnell with CBC. Go ahead, Charles.
Dr. Hinshaw, many people, including some epidemiologists, don't believe that these latest restrictions will be effective. And given that, how did you come to determine that it's in the public interest not to be transparent about the advice that you're giving to the government that is being rejected?
I want to be clear that my role is set out in legislation. And in legislation, the role that I have is to provide recommendations to the minister to promote and protect the health of Albertans and to prevent disease and injury. And that is a role that I take very seriously. And as I mentioned earlier, the recommendations that I made were in the series of options for consideration. The questions about all of the different factors that go into the final outcome, it's really critical that elected officials be the ones to make final decisions, because there are public health considerations, there are other considerations such as the wishes and values of the population who elected the leaders to make decisions on their behalf. And so it is appropriate that elected leaders make final decisions, and I take my role, which is to provide those recommendations to the minister and his colleagues very seriously and do the best job that I can in that role.
All right, we'll take our final question. Operator, could you please put them through?
The final question is from Bill Kaufman with Post Media. Go ahead, Bill.
Yes, hi. I'm just wondering if we know if there's any concern about just how much the shortcomings in contact tracings that we're seeing now, how much is that obscuring just, what we know are the sources of infection, and especially when, planning these measures?
The challenges that we're experiencing right now in contact tracing will make it more challenging to understand with any granularity where our current cases are coming from. That's why we're working with Alberta Health Services to get increased staffing, to streamline processes, to make every change that we can to make the process as efficient as possible so that we can improve the percentage of people who get calls, who complete contact tracing, and the timeliness of that process. In the interim, of course, we do have that challenge of our own local data being impacted. And what we need to do then is look at, again, evidence from other jurisdictions in terms of what the effective interventions are, evidence from what we've seen in the spread that we've had over the past 8 months, and to make sure that we're, again, communicating to the public the importance of those basic measures. No matter what we're seeing in contact tracing, the basic measures will remain critical, which is if you are feeling ill at all, stay home, get tested, stay away from the rest of the members of your household if you're feeling ill, wear a mask even while you're indoors, while you're at home if you're feeling ill, to prevent or limit that possibility that you could infect others in your household. Make sure that you're staying distance from others when you're out, wearing a mask when in indoor public spaces where you're around others outside your household. and making sure, again, regular hand hygiene, keeping hands away from your face. All of those basic measures remain true, whether or not the epidemiology about the locations of spread is available. We do know those basics, and those basics never change.
Thank you all for joining us. As mentioned, Dr. Hinshaw will provide daily updates this week, so the next update will occur tomorrow afternoon. Have a good night.